Yeah, as Laura just mentioned, we know frontline workers will be at the front of the line for this vaccination. But even with that comes challenges that have to be ironed out before the vaccine arrives. Larry Collins has been asking questions, looking closer at what is being done to secure doses for North Texas first responders, and is here now with important information. Larry, good morning.
Good morning, Deborah. Yeah, there are a lot of moving pieces as these plans start to come into focus. There's a statewide task force, a North Texas task force, trying to figure out how to get these vaccines not only to the frontline workers, but to also first responders.
One of the biggest challenges is the geography. So for the first response organizations, especially MedStar, many of our folks are spread out throughout the entire region. So you've got fire stations, you've got police substations, you've got EMS agencies like MedStar that do literally street corner posting for their ambulances.
Now, we're told regional officials are preparing so that on the day that these vaccines arrive, they can be distributed. The big question, is it best to have central locations for first responders to get vaccinated or to take it to them? But keep in mind, refrigeration is one of the main challenges of being mobile, especially with that Pfizer vaccine. MedStar considering using its COVID-19 testing model and converting it for first responder vaccines.
Where we have here at MedStar a testing site for COVID-19 patients, first responders and healthcare workers, and they come here every day, 90 minutes in the morning, to do drive-through testing. We may use that process for the vaccine. So we have first responders that line up and literally come through and stick their arm out the window. We give them a vaccine.
Then comes another question. Who will be able to get the vaccines even within the frontline worker community?
The importance of these vaccines getting to first responders came to light when we were having a conversation with some of our fellow partners when they said, hey, we want EMS to be part of the vaccine administration plan. And we said, okay, does that mean that we get to be vaccinated first? And they said, well, you might not be first, but you might be second or third. And we said, you can't ask people to vaccinate others if they haven't been vaccinated. So we're pretty certain that all of that will work out very, very well.
Now, he explains EMS teams are basically like the Swiss Army knives of the healthcare field. They're able to adapt and change to meet the need very quickly. In this case, that would mean getting the vaccines to not only their own, but also to frontline workers, and eventually to help with the distribution to the general public. Larry Collins, NBC5.
All right, Larry, thank you.